The first thing we have to tell them is that it's a mixture of things that in their environment plus their genes. So we always tell them that genetically they didn't choose their parents, so they can't do anything about that side, but genes definitely play a part. So we tell them that certain ethnicities, certain races are at higher risk. So the environmental side is what you put into your body and basically worsen that. So when you think of the environmental side, this is fats, this is sugars, this is being overweight, this is having high blood pressure, this are doing all the things that we already know are healthy or unhealthy within our society, and those can contribute to your risk of getting type 2 diabetes. When we're teaching people with diabetes for the first time, we really want to stick with things that we know are going to be basic to what they want. So those are going to be things that, if you think about it, when you first meet someone, you're going to be overwhelmed with all these different details. So having diabetes is very overwhelming to people. Some people are still not sure they have it. Some people, so you have to figure out where they're at, first of all. But once you've gotten to the point where you've convinced them they actually have diabetes, okay, well now it's time to lead a healthy life. Think about your diet, think about exercise, and then we're going to tell them about extra things. Well, how can you make sure where you're at? How do you know, just like you look at your, you look on the car and you say how much gas you have, well, now we're going to do something different for you. We want you to check your sugar. At the beginning, it's a feeling out relationship where a lot of times in education, you have to figure out where the person is and where they want to go. And then sometimes you have to redirect them because the place they think they want to go is not really where they want to go. Over time, that relationship will change. As they trust you more, they'll start calling you more, they'll start showing up more. And that's what you really want, is once you have the trust, they're going to start relying on you just like they rely on their doctor. Within diabetes, our role is really to act as the drug expert. But, you know, our role is to say we're not the expert on teaching someone about diet. That's why we have a dietitian. Maybe we're not the expert in teaching them about behavioral. Well, then we have a nurse there, or we have a social worker. So everyone needs to overlap on everyone else's job, but when you come down to what our niche is, it's going to be diabetes medicines. That's why we're pharmacists. The major misconception people have about type 2 diabetes is that it's not preventable, and the complications within diabetes are not preventable. This is absolutely not true. If you can live a healthy life now, if you're at risk of diabetes, you can actually decrease your risk substantially of getting diabetes. A study showed that if you actually eat healthy, get exercise, increase your fiber, do all the things people say they don't want to do, it actually will decrease your risk over even 3 years of about 70% of getting type 2 diabetes. The other misconception people have about type 2 diabetes is the fact that nothing is preventable once you have diabetes. All of the complications of diabetes are preventable. So if you control your cholesterol, control your blood pressure, and keep your sugar under control, you never have to have any of the complications of diabetes. When I talk to someone about diabetes, I have to find their buttons because my buttons don't matter. So when I talk to people with diabetes, it may be, one, their family. Some people, it's, I want to see my grandchildren grow up. Some people, I want to see my children grow up. I want to see them get married. Other people, it's health. It's, don't you want to be doing the things you want to do when you retire? So really it depends on the person. You have to find things that are important to the patient and talk about them, not things that are important to us. When I talk to someone about diabetes, I have to find their buttons because my buttons don't matter. So when I talk to people with diabetes, it may be, one, their family. Some people, it's, I want to see my grandchildren grow up. Some people, I want to see my children grow up. I want to see them get married. Other people, it's health. It's, don't you want to be doing the things you want to do when you retire? So really it depends on the person. You have to find things that are important to the patient and talk about them, not things that are important to us.
Why is it important for students in school, elementary, middle school, high school, why is it important for them to learn about type 2?
It's important for people that are in school right now to learn about type 2 diabetes because it's going to become, and it already is, an epidemic. So right now we know that about 1 in 10 people in our community have diabetes, and this is only going to go up at least until 2050. So because diabetes is such an important problem in our society. You're going to find more and more people you meet on the street every day that have this particular disease. So the more you know about it, the more you can help other people. The best part of being a pharmacist is interacting with people every day. So I think if we're thinking about making a difference as a pharmacist, I think it's important to think most of the times when we make things better for patients, it's going to be in the realm of helping them with medications. When you're thinking about becoming a pharmacist, I think many times we talk first about, do you want to help people? If you want to help people, that's a good start. The next thing is, do you like chemistry and math? Because there's a lot of chemistry and a lot of math in pharmacy. And it's very important math. It's not difficult math, but it's very important math. You have to calculate the dose correctly, and you have to calculate it correctly the first time. When I think about people that I help every day, these are going to be patients with diabetes. So I help patients with diabetes every day. So those are people that come to us from the community who are looking for help with their diabetes. And these, I work in an adult setting, so these are not going to be children with diabetes. We have specialists where I work that actually deal with those particular patients. But we're going to deal with adults with type 1 and type 2 diabetes and other endocrine problems every day. On a daily basis, I work with a lot of different healthcare professionals. I, number one, work with physicians. So physicians are always going to be at the top of the pyramid for taking care of people with diabetes, and rightly so. So many of them, and I work with specialists within diabetes. And a specialist within diabetes is called an endocrinologist. So endocrine meaning hormones, and a specialist in hormones. So endocrinologists are specialists in hormones. I work with them every day. I work with nurses that are committed to diabetes. I work with dietitians on almost every day, and I work with a lot of technicians as far as helping out for drawing blood, or technicians who may help with dispensing medications. These are the typical people as far as other healthcare professionals I deal with on a daily basis. On a routine day in pharmacy, the first thing you have to realize is there is no such thing as a routine day. There's a plethora of different experiences out there for pharmacists, and not every pharmacist works behind the counter. I actually work at a diabetes center. So in my typical day, I'm going to start it off in research. In order to be a pharmacist, currently it's a total of 6 years. So unlike some other professions that you can get into 4, it's going to take a couple extra years to get into pharmacy. On top of that, it's very important to understand that they're going to also need to be active in their community. So being active in their community is actually assessed when they apply to pharmacy. So make sure you're active in your community and you're doing good things for your community. That's going to help.